Chapter 12, Conception through Adolescence. A developmental perspective helps nurses understand commonalities and variations in each stage and the specific impact they have on their patient's health. Understanding normal growth and development will help you predict, prevent, and detect normal expected patterns, as well as any changes in those patterns. Stages of growth and development. Human growth and development are continuous and complex. Stages are typically organized by age groups. When we look at this specific stage, conception through adolescence, we focus on how physical, psychosocial, and cognitive changes affect the health and wellness of this group. Although chronological division is arbitrary, it is based on the timing and sequence of developmental tasks that the child must accomplish to progress to another stage. Selecting a developmental framework for nursing. Planning should be based on a theoretical framework for providing developmentally appropriate nursing care. Organized care should be directed at a child's current level of functioning to motivate self-direction and health promotion. An organized, systematic approach ensures that the plan of care assesses and meets the child's and his or her family needs. If you deliver nursing care only as a series of isolated actions, you might overlook some of the child's developmental needs. Case study. Maria is a student nurse who volunteers in the newborn nursery at a local hospital 2 evenings a week while in nursing school. Maria wants to be a neonatal nurse when she graduates from school. Every year, the hospital she volunteers at offers a postgraduate externship to 2 new nursing school graduates who wish to pursue a career in neonatal nursing. Volunteering within the newborn nursery nurses help Maria hone her nursing skills by allowing her to practice assessments and procedures under the nurse's guidance. Even though Maria is overwhelmed with her responsibilities at school and home, she volunteers in her free time in hopes of improving her chances of being accepted into the Extern program. Intrauterine life. From the moment of conception until birth, human development proceeds at a predictive and rapid rate. During gestation, or the prenatal period, the embryo grows from a single cell to a complex, physiological being. All major organ systems develop in utero, with some functioning before birth. A full-term pregnancy typically lasts 40 weeks. Development proceeds in a cephalocaudal, or head-to-toe, and proximal distal or a central to peripheral pattern. Placenta development begins at the 3rd week of the embryonic stage, and produces essential hormones that help maintain the pregnancy. The placenta functions as the fetal lungs, kidneys, gastrointestinal tract, and an endocrine organ. Because the placenta is extremely porous, noxious materials such as viruses, chemicals, and drugs can pass from the mother to her unborn child. These agents are called teratogens, and can cause abnormal development of structures in the embryo. The effect of teratogens on the fetus, or unborn child, depends on the developmental stage in which exposure takes place, individual genetic susceptibility, and the quantity of the exposure. The embryonic stage is the most vulnerable since all body organs are formed by the 8th week. Some maternal infections can cross the placental barrier and negatively influence the health of the mother, fetus, or both. It is important to educate women about avoidable sources of teratogens and help them make healthy lifestyle choices before and during pregnancy. Health promotion during pregnancy. Women who do not consume adequate nutrients and calories during pregnancy may not be able to meet the fetus nutritional requirements. An increase in weight does not always indicate an increase in nutrients. The pattern of weight gain is important for tissue growth in a mother and fetus. For women who are at normal weight for height, the The recommended weight gain is 25 to 35 pounds over 3 trimesters. As a nurse, you are in a key position to provide women with the education they need about nutrition before conception and throughout an expectant mother's pregnancy. Pregnancy includes physiological, cognitive, and emotional changes, accompanied by stress and anxiety. The expectant woman will soon adopt a parenting role, and relationships within the family will change, whether or not there is a partner involved. Pregnancy can be a period of conflict or support. Family dynamics impact fetal development. Parental reactions to pregnancy change throughout the gestational period, with most couples looking forward to the birth and addition of a new family member. Listen carefully to concerns expressed by a mother and her partner, and offer support through each trimester. Maternal age impacts the fetus. Additionally, older women may have more difficulty becoming pregnant. Adolescents are at higher risk for complications of pregnancy and labor. Infants of teen mothers are at increased risk for prematurity, low birth weight, and exposure to alcohol, drugs, and tobacco in utero and early childhood. Adolescents who have been able to participate in prenatal classes may have improved nutrition and healthier babies. Maternal discomfort is common during pregnancy. Some concerns expressed include problems such as nausea and vomiting, breast tenderness, urinary frequency, heartburn, constipation, ankle edema, and backache. Always anticipate these discomforts and provide self-care education throughout the pregnancy. Discussing the physiological causes of these discomforts and offering suggestions for safe treatment can be very helpful for expectant mothers, and contribute to overall health during pregnancy. The nurse is in a key position to provide maternal education. For example, some complementary and alternative therapies such as herbal supplements can be harmful during pregnancy. Therefore, your assessment should include questions about use of these substances. You can promote maternal and fetal health by providing accurate and complete information about health behaviors that support positive outcomes for pregnancy and childbirth. The transition from intrauterine to extrauterine life requires profound physiological changes in the newborn and occurs during the first 24 hours of life. The APGAR score is a reflection of fetal well-being immediately after birth. It includes heart rate, respiratory effort, muscle tone, reflex irritability, and color. Each of these are rated to determine overall status of the newborn. The score is conducted at 1 and 5 minutes after birth, and is sometimes repeated until the newborn's condition stabilizes. The most extreme physiological change occurs when the newborn leaves the utero circulation, and develops independent circulatory and respiratory functioning. Nursing interventions include the following: maintaining an open airway, stabilizing and maintaining body temperature, and protecting the newborn from infection. The removal of nasopharyngeal and oropharyngeal secretions with suction, or a bulb syringe ensures airway patency. Stabilization of the newborn's body temperature. Newborns are susceptible to heat loss and cold stress, and therefore hypothermia is concern. Hypothermia increases oxygen needs. Therefore, it is essential to stabilize and maintain the newborn's body temperature. Healthy newborns may be placed directly on the mother's abdomen and covered in warm blankets or provided warmth via a radiant warmer. And the prevention of infection. This is a major concern in the care of the newborn, whose immune system is immature. Good hand washing technique is the most important factor in protecting the newborn from infection. You can help prevent infection by instructing parents and visitors to wash their hands before touching the infant. Psychosocial changes are also part of this transition. The nurse promotes the parents' and newborn's need for close physical contact. Merely placing the family together does not promote closeness. Most healthy newborns are awake and alert for the first half hour after birth. This is a good time for parent-child interaction to begin. Close body contact, often including breastfeeding, is a satisfying way for most families to start bonding. If immediate contact is not possible, incorporate it into the care plan as early as possible, which means bringing the newborn to an ill parent or bringing the parents to an ill or premature child. Attachment is a process that evolves over the infant's first 24 months of life, and many psychologists believe that a secure attachment is an important foundation for psychological development in later life. Time for a quick quiz. A pregnant teenager asks the clinic nurse why she should not smoke during the first trimester. The nurse's best response should be: A. The distribution of body hair can be altered. B. The organ systems are beginning to develop. C. Development of fingers and toes can be affected. Or D. The sex of the baby is determined in the first 3 months. The answer is B. The first trimester is the most important period of the pregnancy and fetal development. Introducing foreign chemicals may inhibit organ development. The neonatal period is the first 28 days of life. During this stage, the newborn's physical functioning is mostly reflexive, and stabilization of major organ systems is the primary task of the body. Behavior greatly influences interaction among the newborn, the environment, and caregivers. The nurse is tasked with performing a comprehensive nursing assessment as soon as the newborn's physiological functioning is stable, generally within a few hours after birth. At this time, the nurse measures height, weight, head and chest circumference, temperature, pulse, and respirations, and observes general appearance, body functions, sensory capabilities, reflexes, and responsiveness. Following a comprehensive physical assessment, assess gestational age, and the interactions between infant and parent that indicate successful attachment. Neonates lose up to 10% of birth weight in the first few days of life, primarily through fluid losses by respiration, urination, defecation, and low fluid intake. They usually regain birth weight by the second week of life, and a gradual pattern of increase in weight, height, and head circumference is evident. Therefore, an accurate measurement of the infant as soon as possible after birth provides a baseline for future comparison. Normal physical characteristics include the continued presence of lanugo on the skin of the back, cyanosis of the hands and feet for the first 24 hours, and a soft, protuberant abdomen. Skin color varies according to racial and genetic heritage, and gradually changes during infancy. Molding, or an overlapping of the soft skull bones, allows the fetal head to adjust to various diameters of the maternal pelvis and is a common occurrence with vaginal births. The bones readjust within a few days, producing a rounded appearance to the head. The sutures and fontanelles are usually palpable at birth. The anterior fontanelle usually closes at 12 to 18 months, whereas the posterior fontanelle closes by the end of the second or third month. Assess neurological function by observing the newborn's level of activity, alertness, irritability, and responsiveness to stimuli, and the presence and strength of reflexes. Normal reflexes include blinking in response to bright lights, startling in response to sudden loud noises or movement, sucking, rooting, grasping, yawning, coughing, sneezing, palmar grasp, swallowing, plantar grasp, Babinski, and hiccuping. Assessment of these reflexes is vital because the newborn depends largely on reflexes for survival and in response to its environment. Normal behavioral characteristics of the newborn include periods of sucking, crying, sleeping, and activity. Movements are generally sporadic, but they are symmetrical and involve all four extremities. The relatively flexed fetal position of intrauterine life continues as the newborn attempts to maintain an enclosed, secure feeling. Newborns normally watch the caregiver's face. They have a non-purposeful reflexive smile and respond to sensory stimuli, particularly the primary caregiver's face, voice, and touch. Molding, or an overlapping of the soft skull bones, allows the fetal head to adjust to various diameters of the maternal pelvis and is a common occurrence with vaginal births. The bones readjust within a few days, producing a rounded appearance to the head. The sutures and fontanelles are usually palpable at birth. The anterior fontanelle usually closes at 12 to 18 months, whereas the posterior fontanelle closes by the end of the second or third month, shown as Figure 12-1, fontanelles and suture lines. The American Academy of Pediatrics recommends infants sleep on their backs to decrease the risk of sudden infant death syndrome or SIDS. Newborns will establish their individual sleep activity cycle, and parents develop sensitivity to their baby's cues. Nurses play an important role in demonstrating to parents the correct positioning on the back to reduce the incidence of SIDS. Co-sleeping, or bed sharing, has also been reported to possibly be associated with an increased risk for SIDS. Safeguards include proper positioning, removing stuffed animals, soft bedding, and pillows, and avoiding overheating the infant. Individuals should avoid smoking during pregnancy and around the infant because it places the infant at greater risk for SIDS. At birth, infants are able to focus on objects about 8 to 10 inches from their faces and perceive forms. A preference for the human face is apparent at this time. Sensory stimulation allows infants to seek or take in stimuli, thereby enhancing learning and promoting cognitive development. Crying is a means of communication to provide cues to parents. Some babies cry because their diapers are wet or they are hungry or want to be held. Others cry just to make noise, or because they need a change in position or activity. The crying frustrates the parents if they cannot see an apparent cause. With the nurse's help, parents learn to recognize infants' cry patterns and take appropriate action when necessary. Feeding, hygiene, and comfort measures consume much of an infant's waking time. These interactive experiences provide a foundation for the formation of deep attachments. Early on, older siblings need to have opportunity to be involved in the newborn's care. Family involvement helps support growth and development and promotes nurturing. If parents or children experience health complications after birth, this may compromise the attachment process. An infant's behavioral cues are sometimes weak or absent, and caregiving is possibly less mutually satisfying. Some tired or ill parents have difficulty interpreting and responding to their infant. Preterm infants, and those born with congenital anomalies, are often too weak to be responsive to parental cues and require special supportive nursing care. Nurses can support parental attachment by pointing out positive qualities and responses of the newborn and acknowledging how difficult the separation can be for parents and infant. Health promotion includes screening, use of car seats, and education about cribs. All newborns are screened to identify life-threatening conditions before symptoms begin. If a screening test suggests a problem, the baby's physician usually follows up with further testing and may refer the infant to a specialist for treatment if needed. Blood tests help determine inborn errors of metabolism. These are genetic disorders caused by the absence or deficiency of a substance, usually in an enzyme, essential to cellular metabolism that results in abnormal protein, carbohydrate, or fat metabolism. Neonatal screening is done to detect phenylketonuria, hypothyroidism, galactosemia, and other diseases so as to allow appropriate treatment that prevents permanent mental retardation and other health problems. The American Academy of Pediatrics recommends universal screening of newborn hearing before discharge since studies have indicated that the incidence of hearing loss occurs in as many as 1 to 3 per 1,000 normal newborns. If healthcare providers detect a loss before 3 months of age, and intervention is initiated by 6 months, children are able to achieve normal language development that matches their cognitive development through the age of 5 years. Nurses are responsible for providing education on the use of a car seat before discharge from the hospital. Parents need to learn how to fit the restraint to the infant properly and to properly install the car seat. All infants and toddlers should ride in a rear-facing car safety seat until they are 2 years of age or until they reach the highest weight or height allowed by the manufacturer of their car safety seat. Placing an infant in a rear-facing restraint in the front seat of a vehicle is extremely dangerous in any vehicle with a passenger side airbag. Cribs should meet government standards for the safety of the newborn. Drop-side rail cribs are illegal. Older cribs should be inspected to ensure slats are no more than 6 centimeters or 2.4 inches apart. Mattress should be snug, and crib toys and mobiles should be attached firmly without strings. Case study. Maria continues her assessment of the newborn girl. Which of the following is a normal reflex found in newborns? Select all that apply. A. Blinking in response to bright lights. B. Startling in response to sudden loud noises. C. Performing sucking, rooting, and grasping movements. D. Touching the nose on verbal command. The answers are A, B, and C. Normal reflexes in the newborn include blinking in response to bright lights, startling in response to sudden loud noises or movement, sucking, rooting, grasping, yawning, coughing, sneezing, palmar grasp, swallowing, plantar grasp, Babinski, and hiccuping. Newborns are not able to follow verbal commands. The infancy stage is from 1 month to 1 year of age. Changes occur rapidly in physical, cognitive, and psychosocial areas. The most rapid period of growth and development occurs during infancy. Steady and proportional growth of the infant is more important than absolute growth values. Physical changes include the following: birth weight doubling in approximately 5 months and tripling by 12 months. Height increases an average of 2.5 centimeters, or 1 inch, during each of the first 6 months, then about 1.2 centimeter, or 1/2 inch, each month after until 12 months. Sleep and eating patterns emerge during this time as well. Some reflexes that are present in the newborn, such as blinking, yawning, and coughing remain throughout life, whereas others, such as grasping, rooting, sucking, and the moro, or startle reflex, disappear after several months. Developing motor skills and increasing mobility expand an infant's environment and, with developing visual and auditory skills, enhance cognitive development. Piaget named his first stage of cognitive development, which extends until around the 3rd birthday, the sensory-motor period. By the age of 7 to 9 months, infants begin to realize that things still exist that can no longer be seen. Psychosocially, infants begin to separate themselves from others and begin to form their own identity. At the 2 to 3 month stage, smiling is more purposeful than reflexive. It is important to incorporate play into care because play helps to develop cognitive, social, and motor skills. Infants need to be stimulated according to their temperament, energy, and age. The nurse uses stimulation strategies that maximize the development of infants while conserving their energy and orientation. Infants proceed from crying, cooing, and laughing to imitating sounds, comprehending the meaning of simple commands, and repeating words with knowledge of their meaning. By 1 year, infants not only recognize their own names, and are able to say 3 to 5 words and understand almost 100 words. The nurse promotes language development by encouraging parents to name objects on which their infant's attention is focused. The nurse also assesses the infant's language development to identify developmental delays or potential abnormalities. Initially, infants are unaware of the boundaries of self, but, through repeated experiences with the environment, they learn where the self ends and the external world begins. By 8 months, most infants are able to differentiate a stranger from a familiar person and respond differently to each. Close attachment to their primary caregivers, most often parents, usually occurs by this age. Erikson believed that the quality of parent-infant interactions determines development of trust or mistrust. If an infant is hospitalized, the parent should give most of the care. If possible, please review Table 12-1, Gross and Fine Motor Development in Infancy, as a supplement to this PowerPoint. Breastfeeding is recommended for infant nutrition because breast milk contains the essential nutrients of protein, fats, carbohydrates, and immunoglobulins that bolster the ability to resist infection. Developmentally, infants are not ready for solid food before 6 months of age. Only offer solid foods one at a time to identify possible allergies. Formula should be iron fortified. Cow's milk is not recommended before the age of 12 months. Supplementation with fluoride is generally recommended for breastfed infants. After 6 months, iron-fortified cereal is generally an adequate supplemental source. Parents need instructions regarding the importance of immunizations and common side effects, such as low-grade fever and local tenderness. The American Academy of Pediatrics maintains the most current schedule on its website. Sleep patterns vary among infants. Many parents have concerns regarding their infant's sleep patterns, especially if there is difficulty, such as sleep refusal or frequent waking during the night. Carefully assess the individual problem before suggesting interventions to address their concern. Please review Box 12-1. Warning Signs of Abuse, as a supplement to this PowerPoint. Toddlerhood ranges from the time children begin to walk independently, until they walk and run with ease, typically 12 to 36 months. The toddler's development of fine and gross motor skills supports the move toward independence. Children begin to demonstrate their independence. Their mobility and cognitive abilities are developing. When they get frustrated, the dreaded tantrum may occur. Physically, these children begin to feed, dress, and toilet themselves. They begin to develop fine motor skills as they scribble and draw. Mobility increases as they begin to run and jump and want to ride a tricycle, climb, and further explore. They are able to manage feeding themselves with a spoon without rotating it and can drink well from a cup without spilling. Cognitively, they are putting words together. They recognize that they are separate beings from their mothers, but they are unable to assume the view of another. A toddler's reasoning is based on their own experience of an event. They ask, "Who's that? And what's that?" They also are into "that's mine and me do it." Linguistically, they have a vocabulary of about 300 words by the time they are 2 years old. At 3 years old, they will put sentences together. Talking to toddlers helps their language development. Reading to them increases their vocabulary. Psychosocially, they have a sense of autonomy. Toddlers are still attached to their parents and fear separation. Additionally, these children do not necessarily play with each other, but they play alongside each other, which is known as parallel play. Play expands the child's cognitive and psychosocial development. Parents need to provide toddlers with greater independence, allowing them to do things that do not result in harm to themselves or others. The newly developed locomotion abilities and insatiable curiosity of toddlers put them at risk for injury. Health risks for this group are many. Poisonings occur frequently because children near 2 years of age are interested in placing any object or substance in their mouths to learn about it. The prudent parent removes or locks up all possible poisons, including plants, cleaning materials, and medications. Toddlers' lack of awareness regarding the danger of water, and their newly developed walking skills, make drowning a major cause of accidental death in this age group. Motor vehicle accidents also account for half of all accidental deaths in children between the ages of 1 and 4 years. Some of these deaths are the result of unrestrained children, and some are attributed to injuries within the car resulting from not using car seat safety guidelines. Toddlers who become ill and require hospitalization are most stressed by separation from their parents. Children establish lifetime eating habits in early childhood. The healthy toddler requires a balanced daily intake of bread and grains, vegetables, fruit, dairy products, and proteins. Mealtime has psychosocial and physical significance. If the parents struggle to control their toddler's dietary intake, problem behaviors and conflicts can result. Toddlers want to put everything into their mouths as they continue to explore their environment. Finger foods will let them feed themselves and explore food groups. Increased locomotion skills, the ability to undress, and development of sphincter control allow toilet training if the toddler has developed the necessary language and cognitive abilities. Recognizing the urge to urinate and/or defecate is crucial in determining the child's mental readiness. The nurse needs to remind parents that patience, consistency, and a non-judgmental attitude, in addition to the child's readiness, are essential to successful toilet training. Case study: Maria is working with one of the neonatal nurses during her volunteer shift. Maria assists the nurse with an assessment of a newborn girl. Maria palpates the newborn's head and feels the fontanelles. What should Maria do next? A. Alert the neonatal nurse that there is a problem with the newborn's head. B. Palpate harder to see if a dent can be made in the fontanelles. C. Proceed with the assessment because palpable fontanelles are a normal finding. Or D. Try to adjust the skull bones to move over the fontanelle. The answer is C. Palpable fontanelles and sutures in the newborn are a normal finding. Therefore, Maria should proceed with her assessment. Palpating the fontanelle with more pressure can damage the infant's skull, as can trying to adjust the bones of the skull. The preschooler, age 3 to 5 years. Children gain about 5 pounds per year. The average weight at 3 years is 32 pounds, at 4 years, 37 pounds, and at 5 years about 41 pounds. Preschoolers grow 6.2 to 7.5 centimeters per year, double their birth length around 4 years, and stand an average of 107 centimeters tall by their 5th birthday. Physical changes can be seen in the development of large and fine muscle coordination. Preschoolers refine mastery of their bodies. They can copy figures onto paper. Children this age need to learn and practice new physical skills. Nursing care of healthy and ill children includes an assessment of the availability of opportunities to learn and practice new physical skills. Preschoolers interpret language literally and are unable to see another's point of view. Cognitively, preschoolers demonstrate their ability to think more complexly by classifying objects according to size or color and by questioning. As children near the age of 5, they begin to use or learn to use rules to understand causation. They then begin to reason from the general to the particular, forming logical thought. The brain continues to mature, especially in the frontal lobe, where personality develops. Children begin to interact socially with others of their age. The fear for this group is bodily harm. They have fear of dark, big animals, thunderstorms, and medical personnel. Their vocabulary is expanding from 8,000 to 14,000 words. Psychosocially, preschoolers begin to leave family and explore with other children and other family units. They make new friends. Sources of stress for preschoolers can include changes in caregiving arrangements, starting school, the birth of a sibling, parental marital distress, relocation to a new home, or an illness. Stressful events may cause them to revert to bedwetting or thumb-sucking. Nurses should reassure parents this is normal coping behavior. As language skills develop, encourage children to talk about their feelings. The play of preschool children becomes more social after the third birthday as it shifts from parallel to associative play. These children will play together, play in groups, and pretend play. Most 3-year-old children are able to play with one other child in a cooperative manner in which they make something or play designated roles such as mother and baby. By age 4, children play in groups of 2 or 3. And by 5 years the group has a temporary leader for each activity. Television, videos, and games will help to support learning of basic skills. However, these should be only one part of the child's total play activities. As fine and gross motor skills develop, and the child becomes more coordinated with better balance, falls become much less of a problem. Guidelines for injury prevention in the toddler also apply to the preschooler. Children need to learn about safety in the home, and parents need to continue close supervision of activities. Children at this age are great imitators, thus parental example is important. Preschoolers are usually quite independent in washing, dressing, and feeding. Alterations in this independence influence their feelings about their own health. Nutritionally, these children need 1,800 calories a day, and oftentimes they can be finicky eaters. However, the quality of the food is more important than the quantity in most situations. Preschoolers consume about half of average adult portions. Preschoolers average 12 hours of sleep a night and take infrequent naps. Sleep disturbances are common. Frequently, children have had an overabundance of activity and stimulation. Helping them slow down before bedtime usually results in better sleeping habits. Vision screening usually begins in the preschool years and should occur at regular intervals. One of the most important tests is to determine the presence of non-binocular vision, or strabismus. Early detection and treatment of strabismus are essential by ages 4 to 6 years to prevent amblyopia, the resulting blindness from disuse. Case study continued. Maria knows that infants should be placed in which position for sleep? The answer is, on their back. According to the American Academy of Pediatrics, infants should be positioned on their back for sleep to decrease the risk of sudden infant death syndrome. School-age children and adolescents, age 6 to 18 years of age, expansion, development, and refinement of physical, cognitive, moral, and psychosocial skills occur during this stage. The environment, in which they develop skills, also expands and diversifies. Instead of the boundaries of family and close friends, the environment now includes the school, community, and church. The nurse can promote health by helping children and adolescents achieve a necessary developmental balance. Age 6 through 12 is considered the middle years of childhood. The foundation is set for adult roles in work, recreation, and social interaction. Puberty at around age 12 signals the end of middle childhood. Home and school influence growth and development. This age group is becoming more coordinated in sports and activities that require gross motor skills. Physical growth during the school years is slow and steady until the skeletal growth spurt just before puberty. The average increase in height is 5 centimeters, or 2 inches, per year, and weight increases by 4 to 7 pounds, or 1.8 to 3.2 kilograms, per year. Many children double their weight during these middle childhood years, and most girls exceed boys in both height and weight by the end of the school years. Large muscle coordination improves and strength doubles. Neuromuscular function and skills are refining. The improved fine motor capabilities of youngsters in middle childhood allow them to become very independent in bathing, dressing, and taking care of other personal needs. It is important for the nurse to allow them to participate in care and maintain as much independence as possible. Assessment of neurological development is often based on fine motor coordination. Skeletal growth causes changes in posture and body appearance. Visual acuity sharpens. Fine motor development occurs. Cognitively, this group has the ability to think in a logical manner. They use these skills to solve problems. They are now able to use their developed thinking abilities to experience events without having to act them out. They can concentrate on more than one aspect of a situation. Language growth is so rapid during middle childhood that it is no longer possible to match age with language achievements. Structural knowledge increases. They accept language as a means for representing the world in a subjective manner and realize that words have arbitrary rather than absolute meanings. They reason about word meaning within a context. The major psychosocial developmental task of the school-age child is the development of a sense of industry or competency. They are learning skills necessary for them to be successful in adulthood. School-age children who are positively recognized for success feel a sense of worth. School-age children begin to define themselves on the basis of internal more than external characteristics. They begin to define their self-concept and develop self-esteem, and overall self-evaluation. Peer relationships tend more towards groups. Learning to contribute, collaborate, and work cooperatively toward a common goal becomes a measure of success. Clubs and peer groups become prominent. This is the time for children to have exposure to sex education, including sexual maturation, reproduction, and relationships. Stress comes from parental expectations, peer expectations, the school environment, or violence in the family, school, or community. Latchkey children sometimes feel increased stress and are at greater risk for injury and unsafe behaviors. Deep breathing techniques, positive imagery, and progressive relaxation of muscle groups are interventions that most children can learn. Children during this age group now have more exposure to various environments and less supervision, but their developed cognitive and motor skills make them less likely to suffer from unintentional injury. Some school-age children are risk-takers and attempt activities that are beyond their abilities. Motor vehicle injuries as a passenger or pedestrian and bicycle injuries are among the most common in this age group. Infections account for the majority of all childhood illnesses. Respiratory infections are the most prevalent. The common cold remains the chief illness of childhood. Certain groups of children are more prone to disease and disability, often as a result of barriers to health care. Poverty and the prevalence of illness are highly correlated. Access to care is often very limited, and health promotion and preventive health measures are minimal. During the school-age years, identity and self-concept become stronger and more individualized. The school-age period is crucial for the acquisition of behaviors and health practices for a healthy adult life. Because cognition is advancing during the period, effective health education must be developmentally appropriate. Promotion of good health practices is a nursing responsibility. When their school-age child reaches 10 years of age, parents need to begin discussions in preparation for upcoming pubertal changes. Topics include introductory information regarding menstruation, sexual intercourse, reproduction, and sexually transmitted infections, including human papillomavirus, or HPV, and the need for the HPV vaccine. Nurses contribute to the general health of children by educating them about safety measures to prevent accidents, encourage children to take responsibility for their own safety. School-age children need to participate in educational programs that enable them to plan, select, and prepare healthy meals and snacks to prevent childhood obesity. Children need adequate caloric intake for growth throughout childhood, accompanied by activity for continued gross motor development. Time for a quick quiz. You are caring for a 5-year-old who is hospitalized for stabilization of asthma. To render age-specific care, an action you can take would be to A. Allow the child to handle medical equipment. B. Respond immediately to the child's every need. C. Tell the child to be good. Or D. Rationalize the child's complaint as part of the developmental stage. The answer is A. Allow the child to handle medical equipment. This answer relates to the preschooler's need to understand through concrete experience. During adolescence, age 13 to 20 years old, psychological maturation appears, and reproduction becomes possible. The hormonal changes of puberty result in changes in the appearance of the young person, and cognitive development results in the ability to hypothesize and deal with abstractions. Adjustments and adaptations are necessary to cope with these simultaneous changes and the attempt to establish a mature sense of identity. The nurse's understanding of development provides a unique perspective for helping teenagers and parents anticipate and cope with the stresses of adolescence. Nursing activities, particularly education, promote healthy development. Girls generally have prepubescent changes 1 to 2 years before boys do. There is also evidence that African American girls develop at a younger age than white girls. Hormonal changes within the body create change when the hypothalamus begins to produce gonadotropin-releasing hormones that stimulate ovarian cells to produce estrogen and testicular cells to produce testosterone. These hormones contribute to the development of secondary sex characteristics, such as hair growth and voice changes, and play an essential role in reproduction. They are also linked to body odor and acne. Being like peers is extremely important. Height and weight increases usually occur during the prepubertal growth spurt, which peaks in girls at about 12 years and boys at about 14 years. Individuals gain the final 20% to 25% of their height and 50% of their weight during this time period. Girls attain 90% to 95% of their adult height by menarche, or the onset of menstruation, and reach their full height by 16 to 17 years of age, whereas boys continue to grow taller until 18 to 20 years of age. Fat is redistributed into adult proportions as height and weight increase, and gradually the adolescent torso takes on an adult appearance. Cognitively, this group develops the ability to think rationally. They can determine and rank possibilities, solve problems, and make decisions logically. The teenager thinks abstractly and deals effectively with hypothetical problems. When confronted with a problem, the adolescent considers an infinite variety of causes and solutions. School-age individuals think about what is, whereas adolescents are able to imagine what might be. Adolescents are now able to think in terms of the future rather than just current events. A teenager even solves problems requiring simultaneous manipulation of several abstract concepts. Development of this ability is important in the pursuit of an identity. Adolescents also develop the ability to understand how an individual's ideas or actions influence others. Teenagers also think they are invincible, do not avoid discussing sensitive issues. Asking questions about sex, drugs, and school opens the channels for further discussion. Erikson sees identity, or role, confusion as the prime danger of this stage and suggests that the cliquish behavior and intolerance of differences seen in adolescent behavior are defenses against identity confusion. Adolescents work at becoming emotionally independent from their parents while retaining family ties. They are often described as being ambivalent. They love and hate their parents. They need to develop their own ethical systems based on personal values. Physical changes of puberty enhance achievement of sexual identity. The physical evidence of maturity encourages the development of masculine and feminine behaviors. If these physical changes involve deviations, the person has more difficulty developing a comfortable sexual identity. Adolescents depend on these physical clues because they want assurance of maleness or femaleness, and they do not wish to be different from peers. Without these physical characteristics, achieving sexual identity is difficult. Adolescents seek a group identity because they need esteem and acceptance. Peer groups provide the adolescent with a sense of belonging, approval, and the opportunity to learn acceptable behavior. The strong need for group identity seems to conflict at times with the search for personal identity. The movement towards stronger peer relationships is contrasted with adolescents' movements away from parents. Adolescents need to make choices, act independently, and experience the consequences of their actions. Nurses help families consider appropriate ways for them to foster the independence of their adolescent while maintaining family structure. Healthy adolescents evaluate their own health according to feelings of well-being, ability to function normally, and absence of symptoms. They also often include health maintenance and health promotion behaviors as important concerns. Adolescents try new roles, begin to stabilize their identity, and acquire values and behaviors from which their adult lifestyle will evolve. The nurse's understanding of development provides a unique perspective for helping teenagers and parents anticipate and cope with the stresses of adolescence. Motor vehicle accidents, which are the most common cause of death, resulted in 74% of all unintentional deaths among teens 10 to 19 years of age. Motor vehicle accidents are often associated with alcohol or drug abuse. Other causes of death include bicycling, drowning, and firearms. Adolescents think that they are invincible, which promotes risk-taking behaviors. Homicide is the second leading cause of death in the 15 to 24-year-old age group, and for African American teenagers, it is the most likely cause of death, because having a gun in the home raises the risk of homicide and suicide for adolescents. Include assessment of gun presence in the home when counseling families. Nurses working with adolescents need to be aware of the potential for school violence and include screening questions when providing health care, regardless of the setting. In recent statistics reported by the Centers for Disease Control and Prevention, 16% of high school students indicated that they had seriously contemplated suicide in the previous 12 months. Make immediate referrals to mental health professionals when assessment suggests that adolescents are considering suicide. Depression and social isolation commonly precede a suicide attempt, but suicide probably results from a combination of several factors. Nurses must be able to identify the factors associated with adolescent suicide risk and precipitating events. Please review Box 12-2. Evidence-based practice, prevention programs for school-based violence, as a supplement to this PowerPoint. Adolescents often believe that mood-altering substances create a sense of well-being or improve level of performance. All adolescents are at risk for experimental or recreational substance use. but those who have dysfunctional families are more at risk for chronic use and physical dependency. Tobacco use continues to be a problem among adolescents, and, although its use is declining, 3 out of 10 adolescents are active smokers at the time of high school graduation. Adolescent overweight and obesity are current concerns in the United States, and most teens try dieting at some time to control weight. Routine nutritional screening should be a part of the health care provided to all adolescents. Areas to include in the assessment are past and present diet history, food records, eating habits, attitudes, health beliefs, and socioeconomic and psychosocial factors. Be aware of anorexia and bulimia. If left undetected and untreated, these disorders led to significant morbidity and mortality. Because adolescents rarely volunteer information about behaviors to prevent weight gain, it is important to take a thorough diet history. If left undetected and untreated, anorexia nervosa and bulimia led to significant morbidity and mortality. Sexually transmitted diseases are the most common communicable diseases among adolescents. Sexually active adolescents should be screened for STIs, even when they have no symptoms. Be proactive by using the interview process to identify risk factors in the adolescent and provide education to prevent sexually transmitted infections, including human immunodeficiency virus, HPV, and unwanted pregnancies. The United States has the highest rate of teenage pregnancy and childbearing annually, compared to other industrialized nations. Pregnant teens need special attention to nutrition, health supervision, and psychological support. Adolescent mothers also need help in planning for the future and obtaining competent daycare for their infants. Community and school-based health programs for adolescents focus on health promotion and illness prevention. Nurses need to be sensitive to emotional cues from adolescents before initiating health teaching, in order to know when the teen is ready to discuss concerns. Discussions with adolescents need to be private and confidential. Nurses play an important role in preventing injuries and accidental deaths. As a nurse, identify adolescents at risk for abuse, provide education to prevent accidents related to substance abuse, and provide counseling to those in rehabilitation. Minority adolescents experience a greater percentage of health problems and barriers to health care. Issues of concern for these adolescents living in a high-risk environment include learning or emotional difficulties, death related to violence, unintentional injuries, increased rate for adolescent pregnancy, sexually transmitted infections, HIV infection, and acquired immunodeficiency syndrome, or AIDS. Poverty is a factor that may impact all aspects of their lives. With knowledge about various cultures and the means to care for minority adolescents, the nurse acts as an advocate to ensure accessibility of appropriate services. Research about gay, lesbian, and bisexual adolescents is limited, even though some adolescents experiment with same-sex relationships. They may not become homosexuals. This group does have an increased vulnerability to depression and suicide. Members of these groups who disclose their orientation are subject to violence, harassment, and family abuse. If a teen chooses to disclose sexual orientation to you, help the adolescent construct a safety plan before telling the adolescent's family or friends in case the response is not supportive.